this foundation is called Precious Nwodo Foundation. The short form is QPNF. So we're here today to sensitize, to enlighten you about, you can see here, Padidel. So we'll be talking about puberty education and menstrual hygiene management. We are all girls, so it's going to be an interactive session. I'm not a lecturer. Don't look at me like one big aunt. No, I'm your friend.
We're going to have a practical example today. So a few of you are going to teach us how to wear a sanitary pad. Because some of us, we don't know how to wear it properly. You wear it and you get stained. True or false? Am I not communicating? Okay, yes, so look at it. Why is your period painful? Some of us will have painful period. Let me go to this side. I told you it's going to be interactive. So who is going to answer this question? Don't look at the slides. Will you help us? Okay. Christabel says since the egg is loose and there is no sperm to fertilize it, so when it breaks, you feel that pain. Okay. See what we said here. We said during menstrual period, your uterus is another word for womb. Do we know? Okay. Uterus is also called womb. It contracts. Okay. So when it contracts, it helps. The line, let me just say, it helps the body of that, your womb, to start expelling, to start shedding out and all that. But there is one hormone called prostaglandins. You can see I tried to hold it. That hormone is what is involved in the pain. It's very, very normal. And the pain and inflammation, it triggers it. The uterine muscle contraction starts contracting. Those are something is squeezing, and all. That's what is giving that pain. So the higher level of prostaglandin, some persons in their body, they have this hormone, this prostaglandin hormone, they have it in a high level. So in a scenario whereby now yours is, let me say for example, supposed to be 5, and your own is 20, for example, you see you're going to have the menstrual cramps. So that prostaglandin is what causes you have the period pains. Are we communicating? We have 3 books here by the son of the house. So we're going to be giving it as prizes to 3 students that are going to answer questions. Apart from that, we have other gifts for you also. Let's try to pay attention and get all this thing. So you can see the phases: follicular phase, the ovulation, and the luteal phase. Let me go to the diagram so it will be very, very quick for us to get. So I'll just use the diagram and explain to us. So you see this diagram here is the ovulation cycle. Is your menstrual cycle. At first, let's say you have, I'm going to come to those that haven't started experiencing their period. I'm going to talk about that for like 2 minutes. It's my favorite, right? So you have like a period for, some persons have 3 days. Am I communicating? Yes. Some 4, some 5, some 6. Do you have 6? Yes. Some 7? Yes. Good. So it is normal. Don't feel that Precious is having 3 days and Blessing has 5 days out. Blessing is equal. No, it is okay for you to have different days because we are all built in different form. You are not he, I'm not you. So let's say now this first example is having a period is from 1 to 5 days. While the second diagram has, do you have a pointer? While the second diagram has 1 to 7 days. So this period, these days are where you see your period. After that day, let's say you are a 5-day female. After that day, from day 6 is your follicular phase. Follicular phase, the phase immediately after your period. You see your follicular phase. After follicular phase, you see now the fertile phase. The fertile phase is during what? Ovulation. So you can get pregnant at your fertile phase. That phase, you're very, very fertile. So you're having your ovulation. So persons, they get to see the ovulation at day 14, some at day 15, depends on your cycle. Am I communicating? Yes. Is it getting complex? Okay. So some persons, they have 28 cycle, right? Some has 30 cycle. So we're going to teach you how to calculate and know when is your fertile period, when is your infertile period, when you're expecting your period, because some persons, they don't even know, they just come to class and they just get up to notice that you're staying. So we are here today to teach you that and to know that no, you can actually, she's laughing, I think she has experienced it. Or she knows someone that has. So to teach you and know how you'll be able to calculate that, okay, I'm expecting it tomorrow or next tomorrow. But mind you, it can vary. Okay, you can see this month now, 27th. Another time you can see 28th. Another one you can see 26th. It will come back. It's very normal. But it shouldn't happen for too many months consecutively. That is what we call sometimes hormonal imbalance. So you need to talk to mommy, so they'll take you to the hospital and check. If it's okay, the gynecologist will tell you that it is fine, it is proper. They'll have to run some checks for you and know. 8 to 13. Another person? Any contribution? Huh? 9 to 15. Okay. She's saying no. What's your one? You just.
I think like 11 to.
Can you hear her? 11 to 15. 11 to 15. Okay, I remember then when someone started menstruating at 8, it's very, very weird. It's strange. But now the things we eat, I don't know, the physiology of the body, how we grow and all that, you notice that even a child of 8, 9 has already seen her first period. What's the name of the first period? They have a name. N-E-N-A. R-C-H-E. You will still browse for the correct spelling, but that is the first period. So what I was trying to say is that from 8, you can see, so we have at least from 8 to 16, 8 to 15. That's the range. But on a normal, it starts at least 12. At least 12-year-old she starts seeing her menstruation. Am I communicating? So if it lingers for like 16, 17, 18, 19, 20 years, you haven't seen. You need to talk to your parents so they'll take you to the hospital. Why? Because you need to see a gynecologist. Look at the tips. You change your pad frequently. Try to use cotton sanitary pads. Clean usable pad properly. You know, some persons they use tampons. Some persons they use menstrual cups. Some persons they use sanitary pads. And some persons they use pant liners. So all of these are very, very okay. But what we have here is a sanitary pad by Moped. Do we know Moped pad? So Moped sponsored this project. A round of applause for Moped. So you keep your vagina area clean. You wear comfortable, clean underwear. You use the right washing technique. Discard use sanitary product properly. All those in the body, the hostel, try to dispose them very well. The day students are home, you dispose very well, so don't just throw it anywhere. It's a very, very sensitive and private material, so you dispose properly in the trash. So consult the gynecologist if having irritable or sensitive skin rash. You know, sometimes you use a pad and you tend to get some reactions after using it. Have anyone experienced that? It happens. Some person have very, very sensitive skin. So you notice that most of the times they have some skin reactions. So you quickly talk to the doctor. And we're still here talking about how to clean, you wash. So we have you change your pad. Don't have one pad from morning till night. This is very wrong. So try to use a pad. Like this one now, it comes in folks. One like this, it comes in 2 pieces. One for day, one for menstruation is not a taboo, it's a natural process. You should be proud of it because you are now an adult, so you shouldn't feel that you're going to have an active lifestyle because of a particular process.
So you can see this girl so happy, you know? Yes. She's like, oh, how is that possible? Yes, it is. It's not a sickness, okay? So you have to be happy, so that what do you want to say? Yeah. So let's go. So for the menstrual pain, what is PMS? Another question. Please tell us your name and your class. Olamide. Abisoye. Okay, right for Olamide. So PMS means premenstrual syndrome. So what are the premenstrual syndrome? Can we just have someone to this slide? 2, 3 persons. Someone else. After her. Don't look at our slide. Don't look at the slide. Come on from the page. Come my way.
Nausea.
What's nausea? What's nausea? When you don't feel like praying. Like you want to believe but not come just here. So the last one is what?
Back pain.
Back pain. With the round of applause for her. Someone else please. The round now. I'm coming to you. Good swings, yeah. Don't let me beat anybody, right? Yeah. Please say yes. Bloating. What's bloating? Do we know? Tell them what What is always correct? Swollen breast, your breast tends to be tender. Sometimes it hurts you when someone mistakenly hits you, right? Big girls, right? So the treatment for some of this, you could have a shower, and you rest. You could actually go. You could have a warmer, just place it on your tummy to try to ease the pain, the abdominal pain, you know. You will have analgesic. Analgesic is like Panadol. Panadol is very okay. But for some that it doesn't work, you will get a stronger NSAID. NSAIDs are non-steroidal drugs that's for pain. So if you get any of those like diclofenac or ibuprofen, but if you're getting it, if you're an ulcer patient, it's not advisable for you to really do well on it because it has its own side effects. So I would just advise you to just do the Panadol. That's it. And healthy food too, and herbal tea. So we just talked about this in our menstrual crisis, the same thing, but I just try to put a lot of pictures so it will be interactive and we tend to get it all. No. So the practical ways on how to wear a sanitary pad will be done by our volunteer here. And for the conclusion, we said that with the help of other NGOs, we can reach out to those rural areas where there are no education institutes and facilities to spread awareness about puberty-related issues and most importantly, menstruation. Many NGOs are already reaching out to many areas, but it's not enough and there are still many people who think puberty is a topic that needs not to be discussed and can be dealt with their own way. You know what we said this particular paragraph? You know, we came along and we were like, puberty education, menstrual, whatever. So so it's nothing to shy about. Okay, sex education is very okay. You need to know what you're expecting. At least now we've had this awareness. Like my baby girl here that hasn't really experienced it. When it comes, she knows what it is, right? So we need to be informed beforehand so you don't feel okay you're sick or it's something that is not normal. So it is very, very normal. When you get to start seeing the symptoms, it is okay. So the government can also play an important role in the spreading of this awareness by including practical topics in the textbook and also by giving instructions to schools to conduct a detailed session on the importance of the awareness of this topic. So with this, I would say thank you for this session. How to wear a sanitary pad. So this is your pants, you know you're wearing it. So yes, next one. You turn it like this. You turn it, so you're using your turn it backwards.
Something like this. Then you wait. But you have to turn the hands to the right so then you wait.
We can give people a round of applause. Thank you. I want to dispose the next what we need to do. Use it to hold it, place it here. Neatly.
That's it. It's very
In case if you don't have the wrap,
you can put it in a line like that.
Exactly.
Yeah, a line on and throw it.
and then please don't throw it anyhow. That's the emphasis.
It's yeah.